So now we are going to proceed to our scapular region. From scapular region, let's start our marking. Surface landmarks. This is only and only for a general concept and nothing is asked as of level of MCQ or SCQ. So you can just either give it a read or skip it. Next are the muscles of the scapular region. The muscle of the scapular region, yes, you have to do them. As I always recommend you, the best book for the muscular table is Snell. Do the scapular muscles from there. They are very important to be asked. They often come with the name of the rotator cuff muscles. Mark my words. They will be asked in paper many times because they were a university question at my time. So I recommend you people to do this. Rotator cuff muscles are highly important. You have to do the origin, insertion, nerve supply and action. What are the rotator cuff muscles and the origin, insertion, nerve supply and action? This is an important SCQ as I told you. Next we are going to move to our next question will be structure under the cover of deltoid. Now look, you might be thinking these are too many structures, how can I do it? I will make it very easy for you. First of all, whenever you're doing structure under the cover of deltoid, write the nerve supply of deltoid. So what is the nerve supply of deltoid? You have to write it. It is axillary nerve. So for deltoid, what is the nerve supply of deltoid? Axillary nerve. Axillary nerve will be present under it. Next you have to do the vessels that are close to the deltoid muscle. It will be the vessels that supply the shoulder joint. They will be the anterior and the posterior circumflex humeral vessel. Now vessels are clear. Joints and ligament. Close to deltoid muscle, what are joints and ligaments? Joint of shoulder joint and ligaments of shoulder joint. You don't have to write the musculotendinous cuff or coracoacromial ligament. You can write shoulder joint and its related ligaments. And when paper comes, you will already know what are the ligaments of shoulder joint. You can pinpoint them here, or you can just write shoulder joint and its ligament. Next come what are the bones under the cover of deltoid. So as you know, where deltoid muscle is, it is present near your chest, near your shoulder region at the upper chest level. So for this the bones that will be closer to the humerus and the coracoid process scapula. Humerus and the coracoid scapula. As you can see from the diagram, humerus and the coracoid scapula are very clear one. So it is now clear bones. For muscles, you don't have to do the insertions of origin of. You can generally write what are the muscles. So don't write insertion origin, just write the names of muscle unless they ask what are the particular insertions and what are the particular origin. But if the question comes, just write muscles and don't write insertions origin because it will be very complicated for you to do that. So you can read pec minor, supra, infra and teres minor, subscapularis, pec major and teres major. You don't have to do all of the muscles. You just can do any 4 to 5 or 6 muscles from this table. Coracobrachialis or tricep brachii, bicep brachii, tricep brachii. I think these are more than enough. Also, they might have read long hair or tricep brachii from the supraglenoid tubercle, from the infraglenoid tubercle. Just read the bicep brachii, tricep brachii. This is enough. You don't have to do the full lines. Just name of the muscles are enough here. I hope my point of view is clear. Next is the bursa. So the most popular bursa in relation to the deltoid would be under subscapular and infraspinatus bursa around the shoulder joint. You can write it as the bursa around the shoulder joint. You can write the bursa around shoulder joint in bursa under the cover of deltoid. Yes, in the bursa is subacromial or subdeltoid bursa. It is very important. Subacromial or subdeltoid bursa. Let's proceed to the next topic we have here is there will be some clinical tables. Right, you can see this clinical. I always recommend you to do the clinicals on the combined PDF that is sent you in the group because it is very easy to do it from here. Yes, this clinical is very important. Intramuscular injections where are given deltoid, and this clinical is also very important. What will happen if the axillary nerve get damaged? How does the axillary nerve get damaged? Axillary nerve gets damaged in the dislocation of shoulder joint, and when the axillary nerve get damaged, it will cause paralysis of the muscle supplied by it. So the muscle supplied by the axillary nerve is deltoid, so it will cause paralysis of deltoid. So I hope you are now clear. Next we move to our next topic. You have to do the clinicals on the muscle table, but just give it a read or tick or put a tick on them when you do this from the combined PDF. Like I did my clinicals from combined PDF, and now I read it. It is the same that were written there, so I put a tick on it, and I don't have to like reread it because I have already done it in the combined PDF. Next will be musculotendinous curve, rotator cuff muscle. I already told you in the previous chapter what are the important muscles. Subacromial bursa. You can just subacromial bursa is actually important. You have to do a few points related to it, but we will do it in the shoulder joint topic, not necessarily from here. If you want to do it from here, this is an MCQ. Largest bursa of the body, subacromial bursa. So it is below the coracoacromial arch and deltoid muscle, and it has great value in abduction of the arm and the shoulder joint. It protects supratinius spinatus muscle. Just these points are enough to be done from this paragraph, but if we have to do a little bit more detail of it, we will do it from the shoulder joint region. Next, the intermuscular spaces. For intermuscular spaces, I will send you notes, and I will also recommend you my YouTube video, which will be in Urdu, but you can actually grasp the concept from there by the diagram. Intermuscular spaces mean spaces between the muscles which are present at the back of the scapula. At the back of the scapular region, there are some spaces between the muscles, and they are organized like this. Now look at this diagram. These spaces are organized like this: upper quadrangular, upper triangular, and lower triangular. You have to do their boundaries, and you have to do the contents in them. I will give you my notes, and you can do this thing from there. Next will be the axillary or circumflex nerve. For nerves, yes, nerves are highly important, but you have to do the nerves at the end of your upper limb. When you complete your all region, instead of doing this nerve in a region-wise region, like you will do the nerve in the arm, the nerve in the hand, no, do them combinedly. Do the nerves from your brachial plexus to your hand of full view, so you can have a summary of all nerve instead of doing them in a topic-wise topic. If you do them topic-wise topic, region by region, it will be very hard to memorize them. And if you will do them in a flow from brachial plexus to your hand, you will be easily able to tell the examiner which nerve is where and what is course. So we will do the axillary nerve or circumflex nerve as a combined as a whole in a separate day combined for nerves. Next we have the anastomosis around the scapula. This picture diagram is very important. It has been asked in a paper many times. Anastomosis are the connections between the different arteries connecting them for collateral supply of the blood. For example, if someone shoots a gun injury, if there is some gun injury and there is a flow of blood, so to compensate that flow of blood, there will be a collateral circulation. There will be some accessory channels that will connect with each other to overcome the blood loss. So this is the anastomosis around the scapula, and this is a very important point too. The diagram is highly important. I will recommend you a YouTube video, and you will have to do that video to draw this diagram. And next is that you have to do this diagram. You have to know what are the branches coming from different parts and how all this is organized. So it will be very easy for you to do that from the diagram. The anastomosis is actually divided in two parts: anastomosis around the body of the scapula and anastomosis around the acromion. So do that from here. Next will be your clinical pink boxes. These facts to remember are MCQs. You have to do that from here. Clinical anatomy, give it a read. It may be asked in an SCQ, and these arterial anastomosis and this you have to do. Yes, you have to read them. This is important. And when you do that combined PDF from clinical to combined PDF, put a tick on them that you have done this from there too, because combined PDF is actually a combination of clinicals from BD as well as KLM to help you in prof exam. So this was your scapular region. I hope it is clear.